Good evening, ladies and gentlemen. On behalf of the Department of Aesthetic and Reconstructive Surgery, Max Hospital, Noida, I welcome all of you. Together, we have gathered here tonight for the formal launch of Robotic Hair Transplant Facility at Max Hospital, Noida. And now, without any further ado, for the lighting of the lamp ceremony, I would like to invite on stage Dr. B.B. Sinha, Senior Consultant of Max Super Speciality Hospital, Patparganj. So please give him a round of applause. Sir, could you please join us on stage for the lighting of the lamp ceremony? Can I also invite on stage Dr. Manoj Kumar, Senior Consultant and Coordinator, Dr. Viraj, Senior Consultant, Department of Aesthetic and Reconstructive Surgery, and also Dr. Hair, General Manager Operations, Max Hospital, Noida. Looking good is important. And yes, why not? Because when you look good, you feel good. In my opinion, well, zindagi na milegi dobara. You get one life and everyone deserves to look happy and feel confident about themselves. So on that note, I would like to invite our first speaker, Dr. Manoj Kumar, Senior Consultant and Coordinator in Max Hospital, Patparganj. Max Hospital, Noida as well as Patparganj. And I would like to invite you on stage. Dr. Kumar is a leading consultant in plastic surgery in Delhi and NCR region for the past 14 years. Before that, he worked for more than 10 years in UK, and he has a senior fellowship from the best institute of the world, Stanford Institute of Cosmetic Surgery, London. So Dr. Kumar will be presenting on aesthetic surgery, the current perspective. Doctor, could we please have you on stage? Over to you.
Good evening, ladies and gentlemen. I am going to talk about the cosmetic surgery current perspective, and I won't be wasting time in talking into great details about the technique of surgery, but I would rather concentrate on its relevance in the current scenario. Plastic surgery, as we know, has got two major subdivisions: cosmetic surgery or aesthetic surgery, and the reconstructive surgery. In the common aesthetic surgery that we do is facelift, breast surgeries, including male gynecomastia surgery, liposuction, rhinoplasty, micro hair transplant, chin and cheek implants, moles, scars, etc. Coming quickly to facelift, this is one operation. If you look, the number of cases we do in India is far less than countries like US or Europe. The reason is simple. Most of the patients that we have in the developed countries are the front desk ladies. Often for them, facelift will get their age back by 10 years or 15 years, and they will get them a job for another 5-10 years. Whereas in India, because of the obvious cultural reasons as well as the fact that there are no such things like that, the number of cases that undergo facelift is very little. However, the scenario is changing. If somebody wants to look younger, there is no reason why she or she should not undergo the facelift surgery. Facelift, you can see, this is a typical lady, and is a foreigner case. And by chance, I would say luckily, even in India, when we do plastic surgery, particularly facelift, a lot of foreign patients come here for this procedure. So even in India, we end up doing surgery on foreign patients more as far as facelift is concerned. You can see the effects of age can changes, the patients get rejuvenated, but this is not simple. The operation is a major one. The patient has to pass through various phases of recovery, and as you can see, this is immediately after surgery. It's about 1 week, 2 weeks, and usually 3 to 4 weeks before, and this is about 3 months after surgery when everything settles down and the patient gets the final result that he or she wants. breast surgery, I will just go through the other aspect of this procedure rather than specifically this procedure, because Dr. Viraj is going to talk about it in slightly longer, more detail. Now, breast augmentation. This is one operation where we have found an increasing demand of this procedure. It's very rewarding. Most of the patients who undergo this procedure are very, very happy. And the question arises: are they really cosmetic? I'll give you a few examples to show that often the so-called cosmetic surgery may be life-changing for the patient, and it is often frowned upon by other people, which may not be appropriate. I would also like to mention the silicone scare. Often people ask, is silicone safe? Is it safe for body or not? The story of this goes back to 90s when the silicone, there were a lot of breast implants being done in US, and some of the patients started complaining that they are having some chronic inflammatory diseases, some of them had breast cancers, and they all accused this breast implant to do. That breast implant, well, silicone implants are the reason behind it. And one of the largest manufacturers of breast implant, Dogon, at that time, decided, instead of pursuing the case, to actually pay compensation to the people who have filed a case against them, because they found out that fighting the case would end up paying much more than what they would if they just pay the compensation. But since then, there has been lots of studies, double-blind controlled studies, which have clearly confirmed that silicone is absolutely safe. It does not cause cancer, it doesn't cause any chronic inflammatory diseases or any other problem.
This is how a breast implant looks, and they can be of two varieties, silicone and saline. Basically the implants that we are using are now silicone implants because they give a more natural look and feel to the breast. The third generation implants particularly, there is a lower risk of capsular contracture, lower risk of rippling or wrinkling of the overlying skin, and there is of course no water splashing movement, which was found to be quite common with the saline implants. Some facts: the procedure is done under general anesthesia or local. It is can be done as a daycare surgery or minimum of 1 day stay. Patient is back to work in about 3 to 5 days. There is no stitch removal required. Implants do not carry the risk of breast carcinoma. And there is minimal risk of implant rupture unless the patient is involved in some kind of an accident. And the implants last for a minimum of up to 15 years. Now coming to autologous tissues, you can take fat from one part of the body and put it in the part where it is required. But the problem with fat transfer is that it has to be done in multiple stages to achieve some kind of a visible result. And this is how the fat looks like, taken from an area of the body like the abdomen and injected into the breast. Limiting factors for this is limited quantity of fat can be injected, limited fat availability, multiple sessions, and sometimes external tissue expansion could be required in some patients. And there is some evidence of fat absorption, approximately 25 to 30%. These are some cases of implants pre and post. Coming to breast reduction. The patient who walks into the plastic surgery OPD with a breast hypermastia problem is a very troubled patient. They don't come for the cosmetic part is the last part the patient comes for. They come because they have a series of conditions which they are very troubled by. Some come with neck pain, some with cervical spondylitis, with radiating pain down the arms, some have a stooping or poor posture, some have difficulty in finding the right size clothes, difficulty in doing any kind of exercise, and mostly a lot of them then come because of social embarrassment. The candidates who are the right candidates to undergo breast reduction surgery: women who have stopped breastfeeding, women with massive breasts who don't intend to breastfeed, and the minimum age of the surgery is 18 years. Okay. Some things I want to highlight is general anesthesia stays for about 2 to 3 days. Patient returns back to work in about 2 weeks, 10 to 15 days. The scars after breast reduction surgery are hardly visible after 6 months. And it's extremely easy to go from a size 40 double D to a size, and that's wrong actually, 36B. And these are some of the most thankful patients which are visiting the plastic surgeon's OPD. The cons are that it may interfere with breastfeeding, that is why there is an age limit. And infrequently, nipple sensation may be diminished, rarely nipple urea, partial or total necrosis. Particularly in cases where massive hypertrophy patients are tackled. These are some of the pre and post results. Coming to mastopexy, it's a smaller version of the breast reduction surgery, and with patients who have drooping breast post-pregnancy, post-lactation. So these are some of the pre and post results. Breast reconstruction, while patients, breast reconstruction following malignancy removal. Why do they want to have a reconstruction? Because I have a long life to live and I want to live it whole. I wanted to once again put on a beautiful dress and fill it all out. Or I was gardening one day, when I bent over and my prosthesis fell out, I called my plastic surgeon. So, these are some of the patient questions for patients who have breast carcinoma who want a reconstruction. The goals, of course, are to create a good mount, create the nipple areolar complex, and achieve symmetry. It could be immediate or delayed surgery. Options for reconstruction are implant with or without expansion, autologous tissues, or a combination of both. Implants are one stage. The skin deficiency is basically uncorrected in this. They are just good for small breasts with minimal doses. And this is a pictorial representation of the same. Then the use of permanent expander along with an implant. One step, it corrects the skin deficiency and multiple office visits are however required. Expander along with an implant is a 2-stage surgery, corrects the skin deficiency and multiple office visits. These are again a pictorial representation of tissue expansion followed by an implant surgery. And this is how it looks. Autologous tissues, again, here we've used a tram flap, a rectus abdominis transverse flap, and tunneled it under the skin of the abdomen, and to create the breast after this had been excised. This is a just pre-op photograph. And this is the result in the post-operative period. Of course, she has a bit of ptosis on the left side, which will be corrected along with formation of the nipple complex. And again, Lardos has an armamentarium for the reconstruction of the breast. This is the muscle which is taken from the back and shifted. This is the Lardos muscle which is taken from the back and shifted in front. Again, the same patient, and she requires a breast lift surgery on the opposite side. Take-home message, breast reconstruction for post-mastectomy patients is a reality due to availability of the latest techniques. Patients who have massive breasts need not feel depressed anymore. There is a solution at hand to literally take the weight off the chest. And like it or not, breast augmentation is here to stay. Thank you very much.
I'm introducing to you the technology of the safer neograft concept. It is a minimally invasive approach to hair transplant. The full form of safer is suction-assisted follicular extraction and reimplantation. As as we know, in all fields of every field of surgery, we are now neo-technology coming in, and with the help of that, we are using minimally invasive surgery. Open cholecystectomy is now a history, and all the patients with gallbladder problems are treated with lap chole. Renal stones at one time used to have a big scar to remove the stone from the kidneys. Now endolectomy or even extracorporeal soft web lithotripsy, which is purely non-invasive techniques, are used. Open cataract surgery is now replaced by phacosurgery, which is again a minimally invasive surgery. Most of the open vascular surgeries have been replaced by endovascular procedures now. Similarly, hair transplant surgery has also undergone sea changes. There was historically this scalp flap and punch graft. These are historical. People used to have bunches of hair on the scalp following this surgery, which looked like quite unnatural and never appealed to the people. Then came this micro hair transplant, which is lesser invasive, where individually grafts are were transplanted. Classically, it is done by the technique called strip technique, where a strip of skin is taken off from the back of patient's occipital region, and from there the hair grafts are extracted with the help of scissors under magnification, and those grafts are now then replaced. Micro hair graft was a great advancement over the other techniques, because the hair here looks much natural. Now, like any other specialty, here also we move to even lesser invasive surgery, and I say maybe about 8 or 10 years ago, the technique of FUE, with manual extraction technique, came up. Now FUE basically means that we don't have to remove the strip of back skin from the back, and instead we remove the hair follicles individually. But this manual technique was very, very cumbersome, and I still remember Egyptians. See, this is a punch, and of course in this punch that plastic cover which can be used here on the punch to make sure that you don't go beyond that is not used, because once you attain a certain degree of experience, you don't need really to do that. But for people who even at the beginning of the training, they will still will be able to make sure that they don't damage any of the hair follicle. And then the second stage comes, that is replantation with the electro-pneumatic implanters. I'll show you the machine, which is there actually. There are two implanters, so the two of the assistants can work from either side, and replantation is again done the same way, without touching the hair follicle. This is the tip of the replanter, it goes at the hair end, and it sucks into it, and then over the holes which are made, they are put again with the pneumatic pressure. So there is no touching of the hair follicle germinal matrix. Now, these are the photographs to show how the punch looks like, and more importantly, how the grafts look like. Anybody who is familiar with the micro hair transplant would consider these are excellent grafts. There is no excess dermis material. The follicles appear completely immaculate, no damage at all, and these are all, each of them is going to survive. Again, closer picture to show the quality of hair graft that we can achieve. Now this is the patient only recently done. It was in fact the first patient of robotic hair transplant I did in Max setup. This is a patient. He had an extensive area, so we decided to do graft for the frontal area only, frontal half only. About 2,000 hair grafts are inserted, which means about 4 to 5,000 hairs, because each hair graft consists of 1, 2 to 3 hair follicles. This is what it looks like in about 4-5 days time, in about 2 weeks time, and the scabs fall, and then it takes about 4 to 6 months before the hair starts growing. And once they start to grow, they will be there for eternity, because these hairs are taken from the area where they are genetically programmed to last for the longest period. Now the same patient, donor area, this is just before the procedure, after we harvested the grafts. This is about 4 days. You can see how quickly everything heals in about 2 weeks' time. You can see it. So these patients, particularly if he were to have another session of transplant over the rest of the area, he could have undergone surgery another easily, because these donor areas again ready to be harvested. Of course, a lot of patients like to their hair to grow before they go ahead for the second phase. But as I told you, there is unlimited, abundant supply of hair follicles in this technology. These are some of the results. Just to show you, the hair looks very natural, and there are some techniques to make sure that the hair don't look like surgical. This is another example. This is a person with extensive thinning of hair of the top of the hair. He had 2 sessions, but you can see the hair density has gone back to near normal. Good result with in a lady with the typical alopecia of the vertex. You can see that. Now, FUE, these are the cases of African patients who have got curly hair. These are the difficult cases for FUE, because with the curliness you can end up damaging more hair follicle. But again, because of the basic principle behind the robotic safer technology, you can harvest hair even from these people. Some more example of how quickly the donor area heals. In 1 week time, the donor area is completely, as you can see, healed. This is a photograph after, before, just after, and about a month later when we are harvesting again. Same here, 4 months later, this patient had a second session. Well, these are details, we don't need to go into those. Now this is the machine, we already have an actual machine here. So this is the extraction part of the machine. As I told you, this has got a punch along with a suction, and a punch goes up to the level of erector pili muscle. By the time it reaches there, the follicle is sucked out. There are 2 replanters on either side, one here and one you can see here. So when at the time of replantation, we can do it from either side. And in my practice, I found that we are able to do at least 3 times more hair grafts, and not a single hair gets damaged or hair follicle gets lost. And we can do it in about 6 to 7 hours with a good team working for us. Now, repeating the slide that I had shown earlier, the safer neograft technology using which is also known as a robotic hair transplant. It is basically suction-assisted follicular extraction and replantation. It is a minimally invasive surgery. Technique is easy to acquire. Again, I will repeat that training is required, but once you get trained, it is easy to acquire and get proficient. Once you get proper training and experience, you can really do it very fast. So, no problem of too long procedure, and you can do many more grafts in the period that normally we do with a strip technique or any other technique. And the fact that it is CE marked and FDA approved clearly indicates that it's completely safe. And as I told you, that we've got a lot of patients in the recent past done by this technique. This is a statistical evidence from International Society of Hair Restorative Surgeons, and we can see from 2004 to 2010-11 the strip technique is going down rapidly, and as the strip technique is going down, as you can see here, the FUE technique is gaining strength, and we have already crossed the stage where FUE is now being done much more extensively than the strip technique for obvious reasons. Thank you.
Now the table is turned to you, audience. We would like to bring Dr. Kumar and Dr. Viraj to be open to questions. Please feel free to ask any questions, any doubts or queries about the safer technology or any other aspect of plastic surgery in itself.
So what happens to the donor area once we take the bunker out of the donor area? What happens to that?
Yeah, I think this is a very good question. See, the donor area, as I told you, that for all practical purposes, when we remove the hair follicles from an area, so long the hair density there goes below about say 20-25% of the normal density, the hair appears to be normal. Although the density of hair will go down, but if somebody looks at it from the distance, it will not look abnormal. So yes, density will go down because you are taking hair, but that hair is being utilized to cover the bald patch, and the donor area, even after 50 to 60% reduction, still they look normal. And as I just explained earlier, we can harvest again and again till we get the number of hair transplant that we need, which is the major advantage over the strip technique. In the strip technique, we take a strip and then we close the wound. Again, if we have to take another strip, we have to wait for at least 1 year. And third time, we just cannot do it because the skin is too tight there. And here, we can keep on harvesting till we get the number of hair follicles we need.
And how much is the time taken for a complete acceptance at the recipient side?
Yeah. Sorry, I didn't get your question.
How much is the time taken for the complete process, acceptance at the recipient side?
Alright, okay. See what happens is that I didn't go into those details actually, although this was there because this is the presentation I made at Dubai in the International Society. But yes, it is a long process. One has to be very patient. After we do the hair transplant, the hair shed off in about 3 to 4 weeks time. So what remains is the hair follicle in the skin. It picks up circulation, but it goes into sleep for some time. And usually in 3 to 4 months time, they start to grow. And what will happen, the patient will feel in about 3 to 4 months after surgery that some hair is growing like beard. And gradually they will grow. Once they come to that stage, then they will continue to grow the normal way. And as I told you, these hair follicles are pooled. They are taken from the area where they are genetically programmed to last for the longest period. And they behave in the same way in the new place where they are implanted. So yes, it takes 3 to 4 months before hair to start to grow again, and maybe another few months before they attain the size of their adjoining normal hair. And from that point onward, there is no looking back.
What is the cost factors involved?
Cost factor, see the strip technique, we have to add the cost of the machine. It's a new technology, it's a costly machine. At the moment we have not acquired the machine, but as we are doing more and more cases, we are going to acquire the machine in max setup. At the moment we are paying 50,000 rupees rental for this machine. So it will be 50,000 over and above the strip technique. And in an average major hair transplant, where we do about 2,000 hair grafts, and 2,000 hair grafts means about 5,000 hair, which is quite a big number. With the strip technique, we often end up doing 800, 900 if we really work hard with a big team and work for say 8 hours, which is the maximum time we usually operate. But with this technique, we can harvest around 2,000 hair in about 6 hours time. We can complete the process, and most importantly, as I earlier mentioned, not a single hair follicle gets wasted. When we do strip technique or even FU with manual technique, we end up, we all know that we end up having lots of rubbish, and that rubbish is nothing but the damaged hair follicle. Whereas in this technique, your tray is completely clean. There is no rubbish, there is no loss of any or damage of any hair transplant, hair follicles.
Is the costing done by the size of?
Yes. So yeah, sorry, I forgot that. Coming back to the point, one major large session, which, as I told you, consists of 4,000 to 5,000 hair done in a single session, about 6 to 8 hours time. The patient ends up paying at around 2 lakh rupees including the cost of the rental for the machine. If he were to get it done by strip technique, he will have to pay 50,000 less. So we are doing it at max setup for 1.5 lakh. The strip technique, patients are offered both the technique, and those who choose this robotic, they pay about 2 lakh rupees. Well, I can't think of any contraindication. Any contraindication for safer technology will apply to any other technology. If there is any skin disease and any skin problem. But yes, I don't think there is any contraindication as such. Safer. I think there's no more questions. Are there any questions for Dr. Viraj? She has shown an extensive array of reconstructive procedures that we do. Yeah, this question I was expecting, otherwise I would have finished talking about it. See, this technique is still evolving. It is about 2 years back when it was introduced. And as I told you, I was one of the first few because I was not very convinced with FU used manual extraction. I thought that is too cumbersome, that is too much damaging to the hair follicle, and you don't end up getting the as good result as you would like to. But this technique, as it is evolving, gradually now what happens, a lot of patients come, they have got a lot of body hair, and they want, and then completely bald head, and they want it on their head. Now see, it's a compromise. The hair that we take, wherever they will take, they will behave in the same way. So if you take body hair, it will grow only as big as they grow in their body. But then for some of the patients who don't have hair at all on their scalp, they are ready to accept it. And yes, we can take hair follicles anywhere from the body. We have taken it from knuckles of the patient, we have taken it from the body, from the chest, anywhere. And it is possible to do it, but only limitation is that obviously these hair are not going in the same way. They're going to grow like the same way as the hair on the scalp. But yes, it is done. It can be done from anywhere in the body. I think that's it. So, carry on.
So with that, we actually reached the end of our CME program, and I would now like to call on stage Dr. Hema Lal, General Manager of Operations of Max Hospital, Noida, to give the vote of thanks.